the experience of medical trauma, particularly when it's prolonged and it's many interventions and we don't feel prepared for it, it's out of our control, can definitely initiate a traumatic response similar to other traumas that we talk about and describe. And that also brings us back to some key areas that we can work with to try to ameliorate or reduce the amount of trauma experienced by the child when undergoing these procedures. So some ways are, talking about predictability. How can we help the child know what to expect, and put as much control as we can into the child's hands in terms of how this procedure goes? Of course, sometimes the child is not going to be open to any of these procedures, but it's working with what we can to provide some predictability, some control, some opportunities for relational support. So we also know that when children have really strong caregivers that are retuned and responsive to their children's needs, this will increase the chance of the child being able to manage these experiences. And one unit where I find we have a strength in this area is on the oncology unit, where I've worked. I find that unit in particular, because they have patients there that are there for longer periods and they're perhaps more sensitive and attuned to these needs. And I'll find very often systems set up with parents where the child has decided they want their vital signs taken in a specific order, or they want to participate in taking their vital signs in some way. So developing a system of engagement and predictability so that the child knows what to expect and feels involved or empowered in the process can be really helpful in making this a less traumatizing experience for the child.